Good afternoon. I'm sorry everybody's been late a little bit, and I know you guys are ready to get going. So it's nice to be here. I don't think I've given a talk much about healthcare in quite a while, other than the things we did as governor. But nice to be here. I want to thank all the individuals that invited me here today, and I want to thank Chip for that introduction. When you're the 100th senator in a seniority-based system, you don't seem as significant as Chip made it. So the first thing I always try to think about is why people do things they do and why people care about things. And generally, if you listen to that, you can figure out what they're going to do. So a lot of people have asked me why I care about healthcare, why I got into the healthcare industry, why I want to try to get things done as a governor, now trying to get things done as a senator. So my background is I never met my dad. I had a wonderful mom. If any of you ever met her, she was a tough lady. Ultimately, she got remarried. I had 3 brothers and a sister, and one had a significant healthcare disease. My parents didn't have healthcare insurance, didn't have access to healthcare. Actually, my brother couldn't get any care in the city we were living in. He actually had to get his care. They finally found a hospital 4 hours away, a charity hospital that would take care of him, and they would only see him every 6 months. So if you grew up in that environment, you're pretty clear that you expect something better for your family and for everybody. So the way I've thought about it when I was in the industry and in my job now as governor and then senator is I think it's very important that everybody has access to high quality health care. Now, in contrast to the people that believe we ought to have Medicare for all, I believe the best way to get health care is get a job. And I also believe that if you care about people getting health care, then you do have to have safety nets, but they have to have safety nets that are funded and that work well. So a little over 8 years ago, I ran for governor, and nobody gave me a chance of winning. All the polls said I would lose, and my state was in deep trouble. We had lost 832,000 jobs in 4 years. Home prices had dropped 50%. More people were leaving the state than moving into the state of Florida at that time. And so I ran on a platform of getting people back to work. I grew up in a family without jobs, so I know the importance of it. And if you care about education, if you care about the environment, if you care about transportation, if you care about healthcare, it's all tied to a job. So we worked on turning the economy around. I said we'd get 700,000 jobs over 7 years, and everybody said that was not doable. We hit 1.7 million jobs in 8 years. And when you do that, what happens is your GDP grows like crazy, and your revenues grow like crazy. So you can invest. Record funding for universities, K-12 education, state colleges, transportation, the environment, and including healthcare. So some things we were able to do with healthcare was this. One, we moved our Medicaid program to a managed care product, which helped us control our cost and also improve our quality. We were able to invest $690 million in cancer research and prevention. We had significant issues such as pill mills when I got in, and we dealt with that. We've had an unbelievable opioid crisis. We've been able to invest millions of dollars in that. Just last year, $65 million. We have record funding for our Alzheimer's initiative and a variety of other programs. Now, my personal belief about healthcare is this: competition works, and consumers are smart. If you make sure there's competition, and if you give consumers enough information to make a good decision, they will. I remember one time I asked my mom and my dad, who didn't have any money, and they were on Medicare. I said, how much would it take for you to change where you get your prescription? And my mom said, $1. So they knew the cost, and they were going to shop around to the extent they could. Now, my first involvement in the political process with regard to healthcare was Hillary Care back in '93 and '94. I've always completely opposed a government takeover of healthcare. In 2009, I organized a group called Conservatives for Patients' Rights to try to promote free market healthcare than a government takeover of healthcare. And now, as we've watched, there's clearly a focus on the government running all parts of healthcare. Now and I think Seema talked a little bit about this, the Affordable Health Care Act, whether you like it or not, it didn't cut families' costs by $2,500. You didn't get to keep your doctor. Premiums didn't go down. Deductibles didn't go down, and co-payments didn't go down, just the opposite. I was talking to a couple the other day. They're on the exchange in Florida, and they said that they've got a $6,500 deductible, so they might as well not have any health care because they don't have access to health care. They said they've got basically a catastrophic plan. If you look at where your federal government is and most of your state governments are, Medicare is going broke. There's no pre-funding for Medicare to a great extent. Medicaid's not pre-funded. We have over $20 trillion for the federal debt, so something's going to give. The Democrats are going to continue to push Medicare for all because what they know is the existing program has not worked that great. But I've been up here now for 8 weeks, and what I've been trying to do is put together groups of people from industry. I met with a group last week, met with some individuals this morning in Florida, and to focus on how do we actually drive down healthcare costs, but make sure we have high quality healthcare and make sure people have good access and they have good patient satisfaction. So right now, the first things I'm going to focus on is one, prescription drug prices they've got to come down. I was with a group of individuals on insulin today, and they said their insulin, one individual said his price has gone up threefold just in the last 10 years. But you hear time and time again how much prescription prices have gone up. We clearly need price transparency, but we've got to do it in a way, whether it's for drugs or whether it's for hospital, that people actually understand and can use the information, not have all this transparency, but nobody can use it. Whether the Affordable Health Care Act is declared constitutional or not, we need to make sure that if people have a pre-existing condition, they can continue to stay on a health care plan. We clearly need less regulation. I believe that 20 years ago, when I was in the business, I believe it even more so today. And we ought to figure out a way to rightfully pay for results, but don't do a program that doesn't work. So what I'm going to do is, as a new senator, is I'm going to try to bring industry people together, and I'm going to try to learn how to do this in a manner that improves industry. My experience in the healthcare industry is people want to take care of people. The government's not the one that's going to have all the answers. It's the people in the industry that are going to figure out how to do this. And my experience with people in healthcare is they care about people. That was one of the great things about working in healthcare. Every day something good happened. Every day you help somebody improve their life. And that's what I think about people in healthcare. I don't believe in grand bargains. I didn't do it as governor. I believe in being an incrementalist and chip away every day at things. Whatever you can get done today that would improve a program, do that. Don't try to have some grand change to something and not knowing what the unintended consequences will be. So that's what I'll be doing. So my goal is to sit down with individuals like you, listen to your stories, knowing that we've got to figure out, all of us together, the price of healthcare has got to figure out, we've got to get it more affordable. And I'm going to start with drug prices, but we've got to figure out a way that we do this in a manner that people can pay for it. When you have a federal government that has $20 trillion with a debt and has run $1 trillion deficits, you know something's going to change. So my office is open. I'd love to sit down with as many as you want to sit down and learn about what we can do to improve it. I believe things are going to change, and I'm going to try to be a positive influence in making sure people have good access to health care. It's nice to be here again. Thank you for what you do for people every day, because every day you can feel good when you go home that you've done something wonderful for people. Have a great day. Bye-bye.